Hi, good afternoon everyone. So I was told that the video wasn't working earlier, so I'm going to start over again just for the fact that halfway through my presentation we lost internet connection. So just to introduce myself, my name is Deshane Gutierrez-Lopez. I'm a clinical psychologist at Counseling and Psychological Services, and today I'll be talking to you guys about autism spectrum, Asperger's, and ADHD. I'm going to talk about what are the similarities and differences between them. Oftentimes, parents would come in for assessment because they suspect that their child may be Asperger's or autistic, and sometimes they get a diagnosis of ADHD instead. And I know oftentimes parents are concerned or wonder, well, how my child isn't hyper, why is my child being diagnosed with ADHD? One of the main reasons why autism or Asperger's and ADHD are oftentimes confused for each other is because clinically they have similar presentations at times. So autism spectrum disorder is a neurodevelopmental disorder that typically means that the child is neurotypical. That means their brain development is different from a typical child. How they interact with the world, how they perceive the world is oftentimes different from a typical child. So they usually have difficulty with social communication, communication skills, repetitive behavior, and oftentimes these can be identified from as early as 18 months or younger, right? Persons who have ADHD is a neurodevelopmental disorder as well that is characterized by either inattention, hyperactivity, or impulsivity, and sometimes both. So what I'm going to focus on is the ADHD in a combined type. And the combined type is persons who exhibit characteristics of both inattentive type and hyperactivity and impulsivity type. And these manifest themselves differently between girls and boys, but they also share some similar characteristics. So there are a lot of overlapping characteristics between Asperger's type. So although technically there is no longer a diagnosis in the diagnostic manual, the 5th edition for Asperger's. Asperger's is still used as a classification among clinicians at times, and even some parents still use the word Asperger's because it helps because autism is a spectrum. It helps to identify a particular group within the spectrum, right? So for today's discussion, I'm going to use the word Asperger's rather than autism, just because I want to focus on persons who may have social communication difficulties and repetitive behavior, but the severity level is not as pervasive as person would normally think when they hear the word autism, right? So I'm using it just as a descriptor to help with the discussion that we're having today. So like I said, oftentimes a person will come in for an assessment because they believe either the school recommended or they are seeing signs that are consistent with a diagnosis of Asperger's, and so they want a confirmation diagnosis. As well, there will be times when a parent come in and say, well, I think my child is ADHD, and they give their reasons why. But instead of getting a confirmation diagnosis, they may get a diagnosis of autism disorder, and then I will describe in terms of what are the characteristics. And so there's always this question, is my child Asperger's? Is my child ADHD? What is happening? How would you best describe my child? And so that's why I decided that today would be a good opportunity to just have the discussion so that we could identify some of the things that are similar yet different, right? One of the main reasons that they both have, one of the main reasons why it's difficult at times to diagnose, even for clinicians, even for myself, that sometimes it really does take a long time to be able to decipher and tease out if a child is autistic or Asperger's or ADHD because of the similarities. One of the main ways that we try to identify the differences is by their developmental history. A person who is Asperger's oftentimes have more developmental delays early on compared to a person who has ADHD. It's not to say that persons who has ADHD do not have developmental delays, but a person who has Asperger's oftentimes have more and more severe developmental delays compared to a person with ADHD. And so that's why whenever you go for an assessment or whenever you're talking to anyone, they oftentimes ask you a lot of background history. They ask you the background history, we ask you the background history, not because we're inquisitive, but our background history tells a lot more in terms of what are the milestones that have met, what weren't met, and what was happening within the environment to help you to identify in terms of where that child is or where that child was in their developmental milestones. So it's very important to keep track in terms of their developmental milestones to be able to help to tease out the difference between Asperger's and ADHD, just because they share a lot of similarities. So one of the ways that we help to differentiate it is their developmental history. So another similarity that they have is they both have poor social skills. And oftentimes people always like to say that Asperger's and autism are pretty much probably one of the spectrum, on the spectrum, and so there's a lot of debate academically in terms of ADHD being a spectrum of autism or another spectrum, ADHD spectrum in a whole, right? Because of the similarities that they oftentimes come across. And remember, like I said in the beginning, they're both neurodevelopmental disorders. So they're both way how the brain communicates differently from a typical child or a typical person, right? So they both have poor social skills. But their reasoning behind the poor social skills is quite different. And I think that is very important. So oftentimes at school, for example, once they see poor social skills, automatically everyone thinks the autism or Asperger's. But persons with ADHD, particularly the combined type, also have poor social skills. One, for a person with ADHD, the poor attentive skill may be because they're not always in tune to the conversation. Two, their impulsivity, always getting in trouble. Their peers don't want to be with them. They could also be somewhat indifferent at times and want to just share the things that they're interested to as well. So that also impacts it. A person with Asperger's, they oftentimes want to have friends as well, but the difficulty at times is in terms of, and some of them could have friends and could make communication really well, but it may be a lot more difficult for them. And so one of the reasons why is because one, they may not always understand all of the facial expression. So they could understand facial expression, but they may not understand all of them, or it may take a longer time for them to catch up. They may also understand the social cues. So a person with Asperger's can understand, but they may not understand as fully. And again, this is because they are a spectrum as well. So it's not to say that a person who is Asperger's don't understand any of these things. Oftentimes they do have these skill set, but it's not as strong. It's not their strongest skill set at times. And so that may make it difficult in terms of always sustaining friendships. But a lot of them do have friendships, and they are able to attain and maintain those friendships. So again, like I said, because it's on a spectrum, it may be strengths and weaknesses. So that makes it even more difficult in terms of how can we identify then what are the differences between a person who is Asperger's and ADHD if they both have poor social skills at times, right? So remember I said that because of how their brain is developed, it may not be a strength for them. So it really is difficult at times to be able to differentiate what makes a person more Asperger's or more ADHD. And so sometimes you may go to two different clinicians that do an assessment, and they both may have sufficient evidence to say, well, this child is Asperger's or this child is ADHD. Again, because of the interpretation of the profile that they're seeing, because there are so many similarities at times, oftentimes you can have two different diagnoses. And so I know as for parents that becomes stressful in terms of, so is my child Asperger's or is my child ADHD? And so we always have to look in terms of how do they present on some of the testing. And one of the ways that we can do that in terms of their fluid reasoning skill. So a person with Asperger's reasoning skills may be a little bit lower compared to their other skill sets, such as their verbal comprehension, such as their memory, such as their visual spatial skills, so they could identify different objects, etc. They may be really good at those, but oftentimes their fluid reasoning skills, their ability to problem solve is weaker compared to their other skill set. While a person with ADHD, their reasoning skill may not be that poor. What may be poor is their working memory, their verbal comprehension. Again, because for verbal comprehension, you still have to be able to focus somewhat to be able to get the information, right? So it has to be really going through the nitty-gritty in terms of their presentation to be able to identify what are similar and what is different in their profile, because they share so many similarities at times. And so it's oftentimes, it is a difficult situation to be able to identify what are the similarities and differences, because again, they share so many, right? They both seem to break rules and seem oppositional at times. But a person who is Asperger's, oftentimes when they do break rules, they don't break rules because they want to be defiant. They break rules oftentimes because they don't understand the rule. Or if you've already given them an instruction and a rule and then you change it up quick on them but you didn't explain that, then they may respond in a defiant way in terms of not doing what you ask them. Is because they don't understand the switch, or they don't understand the new instruction that you're giving to them. While a person with ADHD, they may understand the rule, but they don't, one, they may not want to follow the rule, two, but also because they're impulsive at times, before they could even stop themselves, they're already breaking the rule, or they don't always think. They think as an afterthought rather than thinking, processing it through. Why does this happen? Because ADHD is a neurodevelopmental disorder that affects their executive functioning skills. And their executive functioning skills is in your prefrontal cortex, and that focusing on organizational skills, your ability to problem solve, your ability to focus, your memory, your ability to focus, but also as well to deal with distractions. You're able to minimize distractions and then pay more attention to the things that you want to do, which is a weakness for them. Now, both a person with Asperger's may also have challenges as well with their executive functioning skills, but again, how that presents is oftentimes much different, right? So we always have to understand what really is the motive of the behavior, what really dictates what is the fine line between the characteristics of Asperger's and the characteristics of ADHD. And oftentimes we rely a lot on the testing and how they are behaving and interacting to help us, to give us a qualitative picture of what really is happening. Because if we just rely solely on what we're observing, we don't really understand the behavior. We're just saying, well, he has poor social skills or she has poor social skills, they're not following directions, they need routines and all these things. So we go based on a classic classification that we think is Asperger's or ADHD, and because a child doesn't really fit that based on the behavior that we're observing, we say that no, this child can't be ADHD, or no, this child can't be Asperger's. And so it's really looking fine-tuned in terms of their profile when they're actually doing the testing to get an understanding. So we have the test results, which is the quantitative results, but we also use the qualitative in terms of actually paying attention to how they're interacting with the activities, how they're interacting with the tester, how they're interacting with their family members, and as well getting different behavior from different environment, because we all know that we all act differently in different environment. Different environment call for a different behavior. And so if we have one-on-one, we may be much easier to be able to interact than if we have a classroom of 25 persons or we have to deal with 15 persons. And also as well in terms of the understanding of the adults around us or the persons around us, do they understand what is it that we're experiencing to make accommodation? So all of that plays a factor in terms of how we see a child presenting at times. So everything is not always at face value. I could tell you, even as an assessor, it is difficult for me at times to be able to identify what is the difference between Asperger's and ADHD, because we don't only look at the behavior, we also have to look in terms of how they're interpreting their environment around them, because like I described in the beginning, they're both neurodevelopmental disorders, so it's both way how their brain process the world. And so it's always important to know that while they share similar characteristics, on face value, the purpose of that or the understanding of why they choose to do certain things is quite different. And so that help us as clinicians to be able to try to tease as much as possible what differentiate the behaviors that we see that on the surface they do look similar. Both Asperger's and persons with ADHD also experience sensory integration problems. So oftentimes a parent will come in and say, well, my child is sensitive to noise, or my child is sensitive to a particular food, or he only eats certain things, he's very picky, or these things, and so my child must be Asperger's, or my child must be autistic. But also persons with ADHD also do have these concerns as well. So again, like I said just now, at face value, it may look one way, but until we do further testing to understand and get that entire profile, it's not always as clear cut. For some, they may be okay, this fits classically, but then for others, they are much more complex. And ADHD combined type is much more complex than the inattentive or the hyperactivity, because they're, while we're looking at certain things, when they're combined together, that makes it even more difficult. And again, as a presentation, both of them still seem to be within a spectrum as well, because even for ADHD, we always think about the child that is jumping up around the classroom, or a child who never stops talking. But those are only two characteristics of the entire profile. So it doesn't always, they don't always have to have those impulsivity, and impulsivity doesn't always have to be from jumping from one table to the other for it to appear impulsive. There are other behavior things that they do that are impulsive. So in terms of making swift decisions or changing things really quickly, not completing tasks at times. So impulsivity could manifest itself in different ways, and so that's why it's very important to not just look at children, particularly in terms of, oh, they're jumping around in the classroom or they can't sit still. There are other presentations, that they can manifest that could still fall under the hyperactive or impulsivity, right? So like I said, children with ADHD have more fluid reasoning skills. Their treatment of facts. A lot of times for our persons with Asperger's, once you give them instructions and you tell them this is how it works, they're more rigid within that particular area. So we often say, well, our child could integrate information a lot easier in a particular subject. Again, interest also plays a role, and that is also similar for persons with ADHD as well. So for example, a parent would say, well, he doesn't like to do his classwork, but he can spend hours and hours on computer games. And so the question that we often ask ourselves is, how do we differentiate in terms of this need or this love for Nintendos or games that they could stay focused on it? Could we classify this as repetitive behavior, or is it that they're focusing because of a task that they like, because the games is eliciting these things? So there's always this fine marker, and I think as we're developing in terms of technology, that has become even more difficult in terms of how do we differentiate repetitive behavior for things that we enjoy, for things that they're able to focus on, where we're seeing the strength of their executive functioning skills when they're playing these Nintendo's games or this PS3 or whatever the games are called. How do we differentiate that in terms of, is this does this meet qualification for repetitive behavior, or is it the way how the child is just enjoying the games when they're able to focus because that's when they're able to do that the most, right? So there's always there's never a clear cut, this is directly that, or this isn't it, right? And so we always oftentimes have to rely in terms of parents' involvement, the teachers' involvement, even the community, whosoever interact with the child. We need to get more information to see, is this consistent throughout the different environment that the child is, or is it particularly in one environment? Because then we also need to know if it's pervasive, is it across context, or is it just specifically within this context as well, right? Because we also need to know if the child is doing it by choice as well, because that's also the case. So we still need to identify what is the purpose of the behavior, and I think overall that is very important. So despite them having some similarities and some differences in terms of the reasoning behind it, or the way how the brain focusing on things, they both have a lot of strengths, and having a diagnosis of either one of them is never a death sentence, so to speak. I know people always get nervous when they have to get a diagnosis, but the purpose. Hi, sorry about that. I seem to be having bad internet signal today. I just wanted to wrap up though to talk about the importance that, despite the fact that they may share some similarities and differences, it's important to know that your child is more than just a diagnosis. A diagnosis helps to be able to create interventions and plans, but your child is not just their diagnosis. And what it does remind us that whether your child is Asperger's or ADHD, they still need your love, they will need accommodations, and they need support, and they need people to be around and that understand their challenges, but as well as their strengths, because despite their challenges, they do have a lot of strengths. You know, they're very creative. If you get an opportunity to be able to just understand them, and whether or not you have an official diagnosis or not, whenever you have a neurotypical child or any typical child as well, it's trying to learn to understand who that child really is. They have many different strengths. They're creative. Some of them, if they're good at routine. So we want to be able to know that child for who that child really is. And I encourage everyone, parents, teachers, other professionals, people that interact, is that you try to look at the child for who that child really is. Asperger's or ADHD, the fact of the matter is they will still need your love, they will still need support, and they may need various needs of support. And I believe one of my friend had posted that doesn't mean always equal. We always like to say, well, we need to give each child equal opportunity. And while that's great, equal for each child is different, because what child A may need is different from what child B may have, despite the fact that they may have a similar diagnosis. And so you want to be able to understand that child for who that child really is. Like I said, they have similarities, they have differences. But the one thing that I always try to stress on is that they just need a lot of support and people to be willing to understand who they are as a person. Because a diagnosis does not own, a diagnosis in and of itself is just a diagnosis. It doesn't tell you much. And so it's always important to know who that child really is and getting to know them. Whether you have a professional diagnosis or not, or you as a parent just understand or is aware of that your child is neurotypical, you want to be able to be your child advocate. I think that is always important. For parents, you are always the best advocates for your children. You know how they interact. And even if you don't have a terminology for your child, you can still give that child continued support. And it's just so the diagnosis is to help the people in your child's life to have a better understanding of what they're experiencing. You know, oftentimes people will come in and say, well, this school wants this diagnosis and the child doesn't meet a diagnosis. It's because they have their own preconceived notion of what that child or who that child is. And I always tell people, your child is not just a diagnosis. Okay, so what is the child doing in the classroom, or what is the child doing in the daycare? What is the child doing at home? Because that is very important to understand how the child is interpreting the world, right? And if we know what are their strengths, we also need to pay a lot of attention on what are the strengths of a child. So I encourage you guys, now that we're still in lockdown until school reopen, make a list of all the things that your child is good at, because apart from just sharing what your child struggles with, I think it's very important that we focus on what your child is good at, because the school also needs to know what your child is good at so that they could tap into that as well when they're within the classroom setting, if they're attending school. And if they're not attending school and they're at home, or they have a personal teacher that teaches them at home, you still want to be able to uplift their self-esteem as well, because we have to remember that our world is oftentimes more prepared for children who are typical who their brain development is typical. And so imagine a child who has a neurotypical brain and how they perceive the world. It takes a lot of strength for them to be able to live in our world where we are not always as accommodating. So I think one of the biggest things is whether your child is Asperger's or ADHD is to focus on the fact that they will need accommodation, and is to advocate that your child continue to get the support that they need to be able to survive in a world that has not been readily prepared for your child. So it's moving forward, it's advocating for your child to know that the diagnosis is to help for the interventions, is to help to have a common language to be able to share with others, but your child is more than just that diagnosis. I think that is more important. So whenever parents come in for an assessment, I always tell them that regardless of what the assessment results are, know that you just need to continue to be advocating for your child, and to fight as much as possible for the resources that your child needs. I know that in country we don't have as much as resources compared to other countries, but if we continue to advocate for our children to be able to know what it is our child is experiencing and to fight for them, I think we all have a better chance as a country in a whole. There has been so much development within the past couple of years, and so I just want to stress that I want to say congratulations, first of all, to all the parents who have been there for their children, all the professionals in the field as well. And we can continue to do this. We can continue to support our children. And also, as our children continue to get older, I know that is something that we haven't talked much about in terms of what happens when your child left primary school. A lot of the things that we've talked about a lot has been focusing in terms of our younger population. But what happens when they reach puberty, And so I think that's the conversation that we need to have moving forward, is to help our children prepare as they reach adolescence and adulthood, and how can we accommodate for them in a world, in a society that hasn't really been focusing a lot on when they get older. So I want to thank you guys for listening. I just want to so I'm just going to recap quickly in terms of what is the similarities and difference between a person who is Asperger's and ADHD. And they have quite a number of similarities, but they also have differences. And the differences is based in terms of how do we differentiate some of the things that they have with Asperger's. So they both have poor social skills, they both may have poor executive functioning skills. In terms of being seen defiant, they both may be defiant at times, but their reasoning behind that is also different. Their cognitive profile is also different. A person with Asperger's fluid reasoning may not be a strength compared to a person with ADHD. But again, I'm only speaking in general, and so each child is also different. So we also need to appreciate the individuality aspect of it. So I want to thank you guys for your time, and I apologize for the internet difficulties that we had today, and I do hope that the next time that my internet will be much better. But thank you for your patience, thank you for listening in. I haven't seen any questions, or probably it's my internet not loading them up, but if you do have any questions, feel free to post them and I will be answering them after this. Do have a good day.